The Mindful Medic podcast is proudly sponsored by the Medical Benevolent Association of New South Wales, ACT. The MBA is an independent charity that has been supporting doctors in New South Wales and the ACT since 1896. They provide specialised counselling, information, referral and financial assistance to doctors and their families during times of adversity or hardship. Their aim is to provide non-judgmental support so that the doctor or family member recovers their well-being and independence and, wherever possible, returns to their vocation. Their services are free, specialised and no referral is necessary. All contact is kept strictly confidential and they are independent of any regulatory body. Hello and a very warm welcome to the Mindful Medic podcast. I am your host, Cheryl Martin. I'm an emergency doctor by day and frequently by night too, a certified yoga teacher, an avid runner, an eternal student, and my mind is full. For over 2 decades, I've had a particular interest in the broader definitions of what it means to be healthy and how we move, think, eat, rest, play and engage with each other and the world around us can positively impact our health, our sense of well-being and our ability to perform at our best, physically, mentally and socially. And I often have more questions than answers. So I invite you to come with me on a journey as we explore some modern medical science, ancient wisdom and the art that lies between. I meet inspiring individuals who share their stories, expertise and perspective. And it is my hope that there will be some practical pearls for all of us to help us strengthen our personal pillars of health and bolster our self-care toolboxes. To be mindful, one word, one L, is to pay attention on purpose without judgment in the present moment. So I invite you to switch off, tune in and take this time out for you. I hope you enjoy this episode. Hello everyone, welcome to this very first episode of my podcast. By way of further introduction, I wanted to put some context to the time and very challenging situation that we find ourselves in. As we go to air, we are a few months into a global public health crisis with the onslaught of the COVID-19 pandemic. The word unprecedented has apparently been amongst the most Googled of this time and is now part of our everyday vocabulary. Life as we know it has been redefined and we've been asked to embrace a new normal. Many have and continue to experience real hardship. I've been contemplating, deliberating, procrastinating and probably talking myself out of this project for a number of years now. But in my professional life, I have seen some quite astounding things in recent months in terms of what we can achieve in crisis under pressure when we collaborate. My very wise dad quoted Vladimir Lenin last week, so nothing happens for decades, then decades happen in weeks. And I'm seeing that right now. I've seen that we can escalate what we can achieve to a different level when we sometimes cut some red tape, when we're under pressure and we need to perform. But there's also this idea that you can't let perfect get in the way of good enough. If Jamie Oliver, of whom I am a big fan, and he would be one of my dream guests on this podcast, can produce a TV series on his iPhone with his wife filming him, what excuse do I have? And I think this goes back to another thing the great Mr. Oliver said, And remember, he is also a community and public health champion. We make the most changes when we move from the flashing red zone to the red zone, both at population level and at the level of individuals. It's not about going straight to perfect, straight to green. Small steps, small progress in the direction that we want to go. So I want you to take that with you through today's episode. We're going to kick off this series looking at the idea of exercise and movement as medicine, something I have had an interest in for over 2 decades now. As an undergraduate, I took an extra year to study sports and exercise medicine. And even then, we were starting to look at the idea of exercise as an intervention for health in medical conditions and across the lifespan. And it's interesting, my memory of that year, we had a group of us who were studying different aspects of clinical medicine. So people were studying cardiovascular medicine, cancer studies, neuroscience. And I think a lot of my fellow students looked at us in the sports and exercise medicine group and thought we were a little bit fluffy. I actually wrote a letter that was published in the British Journal of Sports Medicine at the time, bemoaning the fact that our science and our research hadn't been taken seriously. I'm heartened to say that things have improved a bit over the past 2 decades as the level of evidence and scientific rigour has only increased. Our next guest authored a paper 2 years ago in a medical journal arguing that exercise is a polypill.
And my job in my clinic is not really like that at all. It's about keeping people active, keeping people healthy physically, mentally, and it's just about, I know that again, holistic health is a cliche term, but it's more about that.
That was Dr Brandi Cole. Brandi is a sports and exercise medicine specialist and a fellow of the Australian College of Sports and Exercise Medicine. She is a former elite athlete herself and has represented her country and state in a number of disciplines. She admits to loving all forms of movement, exercise and physical activity, with the possible exception of swimming. She's a mother of 2, and she has recently, in the middle of a pandemic, opened her very first practice in the Sydney Southern Shire. Her raison d'etre is to keep us all moving for our health and to help us perform at our best. In this episode, we discuss Brandi's day-to-day work, her extended remit, which might surprise you as a sports and exercise medicine specialist. We look at specific challenges at this time as we face restrictions on how and where we can move. And she shares some personal and professional perils that I really hope you'll find. I know I certainly did, some value in. Enjoy this conversation. Thank you, Brandi, so much for being here this morning. I know you are incredibly busy, and I really appreciate you. I think you're the perfect guest to kick off this podcast, which already discussed with everyone has been a long time coming. So I really appreciate your time. So
thank you. I'm excited to be here.
Great to have you here. I thought I have done a bit of an introduction, but I wanted to get you to do that introduction yourself. I know we're both very passionate about, the role that movement, exercise, physical activity can have in our health and our well-being, and that's what your job is. So I wanted to know how you came to be doing this job and what a day in the life of Dr. Cole looks like.
Sure. So as a kid, I was always playing a lot of sport. Obviously, I think I had a competition with my girlfriend in year 12, how many sports we could play for the school. And I think it was 12. I won with 12, probably to get out of class because it was a valid reason to not go to class. And I was lucky enough to have my parents were teachers, so they could teach me school after school. So it didn't really matter about missing the education side of it. And I think every athlete wants to work at the Olympics. I mean, that's or go to the Olympics. So it started off with I want to go to the Olympics, and then it was like, well, if I don't make it to the Olympics as an athlete, then I want to work at the Olympics. And initially I thought I'd be a sports journalist just because that seemed to be the most obvious choice of people working at the Olympics. I saw them on TV every day. And then I think it was around the end of schooling, I actually got a back injury. I flew to nationals. I was a beach sprinter. That was one of my sports. And Dad didn't want us to get a taxi to our hotel. So he made us carry our heavy bags hundreds of probably kilometres up the road to the bus stop. And I hurt my back like a couple of days before was meant to race. And so we went and found some physios that were attached to the event. And so I met this physio, and he not only did he fix my back, he did things to me that I'd never really seen anyone in the sort of sports medicine world before. And I raced the best I'd ever raced. So I'd gone from thinking that I'd injured myself and that my chances were out to placing, I think I came fourth in one of the finals at nationals, which was huge for me. So that was when I was 16.
And out of interest, can you remember what he specifically did for you at that time?
He was into a lot of things with pelvic adjustments and the sacroiliac joint and the lumbar spine, and just a lot of soft tissue work, but also looking at which muscles of mine were overactive, which were underactive, and just, I guess you would call it sounds a bit sort of Western type medicine, but like a few balancing of my body. And it just really, as a 16-year-old, my tissues were fine, but it just really made such a difference. I guess it freed me up. And as a beach sprinter, you've got to really be able to lift your legs out of the sand. And I probably hadn't been able to do that for a while as effectively as possible. So that was a really, this was in Queensland, and I live in Sydney, and I said to him, like, where do you work? This is amazing. And he could have been from anywhere in Australia, and he happened to be from Sydney, but the other side of the city. And so from then on, I travelled over an hour in traffic, probably an hour and a half, to have treatment from him whenever I needed it. And my dad used to say, oh, you're going for your psychology treatment, because as much as it was a physical treatment, it was also very much so, we chat about things, we discuss things, and it really was a big part of me going through not only my the competition, but also going through high school, trying to get good marks to get into university, all of that. And so then naturally I decided that I wanted to be one of those people, and that I thought I might do physiotherapy when I left school. And so I put that down. And another pivotal memory is that my dad said to me, my dad's a science teacher, but he probably always thought he was going to be a doctor and just never applied for it. My grandma, his mother, always wanted to be a doctor, but when you were born in the 1920s and you're a female, you had to go to work at 15 to support your family through the war. So she couldn't be a doctor for those reasons. I didn't want to be a doctor. He said to me, why don't you put medicine down? And if you don't like it, then go back to physiotherapy. And my words to him were, oh, Dad, I don't want to go to university with geeks. So I didn't become a doctor straight away, and it wasn't even on my radar. I hated the thought of sick people. I hated the thought of hospitals, and to me, that's what a doctor did. Yeah. So it wasn't until my final year in physiotherapy, it's a 4-year degree, that I had to, I even put off all my in-hospital pracs. So I would do all the sporting ones, I would do all the private practice ones, and I left all the mandatory ones to the very end, including ICU and the orthopedics. And I remember loving ICU. I just love physiology. It's just about how the body works. So I really loved that. And that opened, going from hating hospitals to loving the most intense part of the hospital. And then I went away for my last practical. I was doing orthopedic outpatients, but I was staying with a medical student, and they invited me into surgery, orthopedic surgery. And from that point forward, I was just there every week. They thought I was the medical student. And so, chatting with her and realizing that she was just a normal person as well, and that it opened my eyes up to the whole world of medicine. So then I decided I would go and do medicine, and I didn't want to have a full-time job and then go back to being a student. So I sort of pursued that. I had a year off. I worked as a physio to support myself. I went to private practice. I worked with my physio, and I also went overseas and worked with a friend in Jakarta, which was amazing because they don't really have physiotherapists over there. So it gave me the opportunity to be different, and sort of started my love of sports medicine, I guess. But when I went into medicine, I wasn't going to be a sports doctor. I was going to completely go away from that. I actually loved emergency medicine and intensive care. And so all the way through, I was going to do critical care, essentially. And then when I finished, I still thought I was going to do that, but I really couldn't cope with shift work, like physically and mentally. I could could cope at work. My life couldn't cope with it. So I was having my best days at work.
And that's something that we'll probably cover. But on top of, all the sporting activities and things that you were doing outside, there's only so many pieces of pie.
Yeah, absolutely. And mentally, it was very tough because I loved the job, especially in intensive care. I loved the job, but I just didn't love my life outside of the job. And I had a few experiences through medical school that had taught me that I have to be very careful about what I do in my life. And we can go into those later. So it wasn't, I sort of started working, and you go through a few years of rotations, and I was ticking off things that I didn't want to do. And every time I'd move around, it was like, I don't want to do that. I don't want to do that. And I wasn't really sure where I wanted to go. But then, and sports medicine had always been in the back of my mind because I'd had a sports doctor through all my injuries as well. So I was well aware of that the specialty existed. But I just thought that if I was going to be a doctor, I was going to sort of, I mean, I say I do more now, but it's not, that's a very terrible way to talk about it. But I guess that's what I thought back then, that, I've got all these skills as a doctor. Maybe I should use them instead of just going back to what I thought was very similar to where I'd come from in my physiotherapy. It's obviously not that at all now.
Yeah. And my experience of people that maybe had done and practiced as health practitioners as before they became medical students was that they were already light years ahead, and just in terms of their patient-orientated focus. I mean, I think, I don't know if you felt that gave you a different perspective.
Oh, absolutely. It certainly made the medical degree much easier. It was a postgraduate medical degree, so we'd all done degrees before, but you could have done an architecture degree and done medicine with me, and actually a friend did. And they used to say to me at every exam, what was your first degree? And I'd say physiotherapy, and they said, oh, you can definitely tell, just people skills, clinical skills. And it definitely helped.
More mature, and you've had some life experience.
Absolutely. I do notice the difference now in I call them kids because they were so young compared to what I was when, in your first year as a doctor. And even now I had a patient the other day came in and said, oh, you're so young. And I think, oh, how lovely. I'm definitely not young. I've studied 20 years to get here. But like the life experience definitely helps you in your patient interaction, and in, it's wisdom, really. You can't gain wisdom any other way than having years of experience.
And I think the other thing, that very early memory, just something that I wanted to pick up on, you described a health practitioner who saw you, who you developed a rapport with over time, who put you in the context of your life and everything else around it, your physical health, your mental health, and how your body worked on an individual level. I mean, I think that, I mean, I don't know what you think about that looking back now, but I suspect that's how you approach many of your patients now.
Oh, definitely. And to be honest, I think that most of medicine, especially in sports medicine, is teaching the person how to heal themselves. And healing is not just physical. I mean, there's so many times that you get a scan and people say, but there's nothing wrong on the scan. And I say, well, that just means there's nothing structurally wrong. There's no structural damage. But most of any injury or illness in my field is functional. And there's a lot more than just hands-on work. And I actually don't do a lot of hands-on work compared to what I do with education, explaining, enabling people to be able to help themselves. But I say to people all the time, it depends on how much you want this, because you have to put the effort in. And a lot of people want a magic pill, or a magic wand, or a passive fix. They want me to fix them, where really I'm enabling them to fix themselves. And that's definitely how I've experienced it as a patient and as a doctor.
Yeah, no, and I think so, as patient, as athlete, as doctor. I think a lot of people have a bit of misconception still about what a sports medicine, and it's actually a sports and exercise medicine physician now. The college
absolutely
changed their definition and their title a couple of years ago. And I think a lot of people still think, oh, you deal with elite end of the spectrum, elite athletes, you deal with teams, you deal with injuries, and maybe going on tour and traveling with teams. But actually the remit is so much broader. I mean, you have a role in all of us in terms of people who might want to start exercising, people who might have medical conditions, who want to know if it's safe to exercise, people maybe with work-related overuse injuries. Can you expand a wee bit about, what a day in your practice would like and your wider remit?
Yeah, sure. Yeah, that's a really important point. And I've just recently opened up a practice, and I've just done my website. It literally got launched last week. And My biggest focus on my website was to explain exactly what you've just said there, because the whole way through, I've been working as a sport and exercise doctor for 7 years now in the private practice. And the amount of times that people come in and say to me, "Oh, I felt embarrassed in your waiting room. I felt out of place in your waiting room. I'm not an athlete. I don't belong here. Is it okay that you are seeing me? Am I wasting your time?" All of these things. Realistically, I got into sports and exercise medicine because I loved the musculoskeletal system. And I felt as I went through my years as a junior doctor that I realized that doctors don't get taught very well about the musculoskeletal system. And really, the only other specialty that solely does that is orthopedics, and that's surgery. And so you're looking at it from a surgical point of view, not from a holistic point of view. And so it was sort of like a big 360-degree circle for me, and I ended up right back where I had started. But I remember flying to the conference, the first conference of our college, in the first week of me becoming a registrar on the program, and it was like I'd found my tribe of people. I'd gone from being worried about not fitting in as a doctor to finding these people who were exactly me. And it was amazing to find there's more than 150 of them in Australia and New Zealand, and obviously worldwide. And so that was important. And the change to the college, that to add the exercise on, actually came halfway through my training. And I think that was really important as well, because it actually, to me, is more about that. Like, yes, elite teams need doctors, and yes, we do travel with elite teams, and I love my work with elite teams, but it's a very different line of work. That is all about performance. So my role as a doctor in an elite team is to keep the team well. When we go overseas, I'm basically the hospital in the hotel for everything that could possibly happen, and the GP, and a sounding board for the physiotherapist. It's not a lot of musculoskeletal first line, because we have physios that do that, but it's also sort of talking through that. But that's a very small part of my job, and my job in my clinic is not really like that at all. It's about keeping people active, keeping people healthy physically, mentally, and it's just about, I know that, again, holistic health is a cliche term, but it's more about that.
Do you think it's cliche in the medical profession, in amongst doctors? Because I actually think that is health. Health is all encompassing. Do you think it's part of the way we're training, and maybe, looking at the sports and exercise medicine body of professions, maybe they've already started that shift? I mean, I think that's the way we need to look at everything we do. We obviously need a good evidence base. We need the science side, but the science can't answer all the questions. And it's interesting that, I work in emergency medicine, and actually to get robust scientific studies in emergency conditions is actually really hard.
Yeah.
So this takes back to, well, can we place the individual here kind of at the center of this, and can we add a bit of both? It's a bit art, a bit science.
Yeah, absolutely. And it's interesting you say that about the research, because it is very hard to do a lot of research. I've done a PhD, I understand how hard it is, but there's actually a lot of research out there to show that exercise does help. So, for instance, in low back pain, there's only two things that are proven really to help with low back pain, and one of them is exercise. And it's not even specific exercises, it's just being physically active. The same with osteoarthritis of the knee. I mean, that's a huge problem in our middle-aged and elderly population. And the only two things that have been proven to help are weight loss and exercise. But the problem with those things are that people don't need someone to give that to them. They can do that themselves. And so as a doctor, you're brought up to be trying to help someone and fix someone. And so if you're fixing someone by telling them that they need to get physically active and lose weight, then a lot of the medical industry perceive that as, well, what do you need to be a doctor to do that? And so they try and look for these one percenters instead of going with the big picture that will actually help the majority of people. It's the same in sport. You get these, you try and do these really performance enhancing things, like how many elite sporting teams I've been to that do all of these supplements and all of the things like that, which are really helpful, but then they don't look at whether the women are iron deficient or not. So there's bigger picture things that are actually part of everybody's daily health that can actually help with not only your health but your performance. And I think that we're starting to turn the tables. Well, certainly within our college and within the people in our industry, but it's still not accepted in the wider medical community. I think that a lot of other medical specialists they look at us and think, oh, we're not very far off people who use herbal medicine to treat things or something like that. We're not accepted.
You authored a paper with Donald Kwan a couple of years ago, a review article, and you described exercise as a poly pill. I mean, I don't know if you want to expand on that a bit in a bit more detail about the kind of some of the research in exercise in maybe mental health, in some of you've mentioned back pain, you've mentioned osteoarthritis, we've got cancer therapies, there's many other medical conditions. So how do we prescribe the exercise pill?
If you don't write something down as a prescription, people don't take it seriously. So you can say to someone, oh, you just need to be more active, or you just need to exercise, and it doesn't even matter what you do, but people want direction, and it's almost like they want to follow orders. And so if you write a script out for a blood pressure lowering tablet on a script pad, they take that, they go to the pharmacy, they buy their pill, they take it every day as per the directions, and they don't question that. If you tell someone to be more active, they like the idea of it, but they either don't know how to do it or they just don't stay motivated. So I actually write it down, and sometimes I have to write it on a script pad to make them understand that this is as important as taking a tablet. And not only that, if you do this, you probably stop having to take some of your tablets. So it's actually beneficial for that reason. And, there's guidelines. The World Health Organization have guidelines for minimum amount of exercise for health, and it's definitely very different in terms of if you're exercising for health, or if you're exercising to be an athlete, or if you're exercising for performance. But everyone can exercise for health, and that is everybody.
So what are the current guidelines? What's just 30 minutes of moderate activity on maybe 5 days of the week for most days?
Yeah. So they say 150 minutes per week, which equates to 30 minutes on 5 days of the week of moderate activity. And moderate activity is not difficult. It's going for a brisk walk. It's just activity that will, you can still talk in a sentence, but you notice that you're doing something. So I like to explain it. If you're on a phone call to someone, you don't feel like you're puffing, but the person, if you're walking up a hill, someone will say to you on the other end of the phone, what are you doing? Because they can hear you puffing, even though you can't tell that you're puffing yourself. That's moderate activity. So you're not actually aware of it, but if you were to measure your heart rate or measure your breathing rate, it would be increased a little bit, but it doesn't matter that it is. And it's that simple. You don't even have to do fancy things like getting your heart rate in a certain level or getting your breathing rate. You don't have to measure anything. You just go out and you just go for a walk for half an hour. And it can be 3 lots of 10 minutes in the day. It doesn't even have to be half an hour in one stint. And that's the aerobic exercise. So that's like the cardio type thing that people, so if you don't want to walk, you can swim, you can cycle, you can row, there's so many different things that you can do. I like to try and get people outside because it's so much nicer mentally to be outdoors than to be on a machine, but it's whatever the person wants to do.
And so that's really interesting, because at the moment we've got this dichotomy of people who maybe people who previously hadn't become active suddenly have this bit of time outside to exercise, that they're starting to use that, which is exciting. But I think you maybe want to talk a bit more about that. And then you've got the other side of people who are enthusiastic and recreational, or maybe even competitive athletes or elite athletes, who are suddenly facing cancellations of race seasons, of their team sports, of that community and connection, maybe if they meet at the park run at the weekend. So you do have kind of two streams. Are you starting to, so I mean, I think there's a lot of questions, but we'll maybe start with people who are starting to exercise, who should actually see the doctor, or should see a sports physician, or should get some kind of clearance before they exercise, and what are the risks of people just going out there and maybe starting to run or jog or do more than they have ever previously done?
It's a good question, and there are some sort of grey areas to the answer. It's not like extremely clear cut, but there are some sort of good guidelines to follow. Essentially, if you're exercising for the first time in your life ever, it's probably wise to go and see somebody before you start. But if you're just going for a stroll around the block for half an hour, then you think about the fact that you go shopping probably once a week and stroll around for that long, or if you have kids, you pick the kids up a lot. So it's in the context of what you normally do. So even though you haven't done structured exercise before, you might be a physically active person at work. You might actually be quite active in ways that you don't think about. So it's not like you have to go and see a doctor before you step outside the house to go for a walk. Anybody can really go to do some light exercise. But if you go to do a walk and you notice that you're really puffed outside what you think that you should be, or your heart is racing and that's, you become very aware of it, all these things that you notice that really don't seem normal, then I would go sooner rather than later to get a screening, because we can do general, it's really the cardiovascular screening that we're talking about here, the risks of heart attack and things like that. I think it's, the screening is well known in elite athletes now that we do these cardiovascular screenings to try and prevent sudden cardiac death. But we're really talking about the very young population there, so the under 30 population who are doing elite hard physical exercise, and we're talking about congenital and structural heart disease that hasn't been noted yet, that can appear when you push your heart really, really hard. But the other group of people are the over 35s who might have risk factors for coronary artery disease. So that's a very different group of people, and it's a different type of screening to do. But people worry so much about, oh, I might be harming myself if I start some exercise, but no one ever worries when they go and buy a takeaway meal every day and drink a big, drink of soft drink and lay on the lounge for 8 hours a day, 2 days in a row watching TV. And that's probably far more detrimental to your health than going for a walk around the block. So I think we have to put it in context. Run before and suddenly you lose your job because of COVID-19, and then you start doing 12-kilometer runs every day, you're going to get injured. And that's about tissue loading, because our tissues, our ligaments, our tendons, our bones, they like load, but they like gradual increase in load. So if you overload something, and that can be overload by a weight, by a frequency, by an intensity, it all adds up, and then they can't respond quick enough, and that's when you get these overuse injuries. And that's what I'm starting to see now, where I think we're in the 8th week of home restrictions for COVID-19 in Sydney now, and it was around the 6 to 7 week mark that people started to come in with these new pains of their new lifestyle, which is also not great either. You have to have that balance. You have to build up.
Do you think any of that is to do with ergonomics of people maybe working from home, that maybe don't have their stand-up desk or their usual, they're working at the kitchen table like me right at the moment? I mean, do you think that's contributing?
I think it is to a certain extent, but I think it's actually the opposite. I would have thought that, but what I've actually seen is it's almost the opposite. So people in their workplaces are forced to sit at their desk for 8 hours a day, and they rarely take breaks. And we do have these great ergonomic setups, but I'm not sure how many people actually use them well. So even people that I see that have those overuse work injuries, oh yeah, my desk is like this, and I've got someone that came in and it's a sit to stand desk. Oh, how many times do you use the stand up part of it? Oh, I don't really use it. Do you have an ergonomic chair? Yeah. Do you sit right back in it? No, I perch forward on it. So they've got the equipment, but they haven't had the education around how to use the equipment, and so it's actually not really beneficial at all. And then conversely, when you come home, you choose what you do and where you do it. So although the setup probably isn't as great, especially using laptops, it's very, it's not as good as having the screen at the right height and the keyboard at the right height, and I'm guilty of that as well. If you get a little bit of pain at home, you'll just change position. It's a natural thing. You don't have someone looking over your shoulder. You're not expected to sit at the table. No one's there. So you might end up moving around the house more or having more frequent breaks. I know a lot of people who are using their lunch break to go for a run because they don't have the travel time to and from work, so they're actually gaining more time so they can split their day out, which is so much more productive too, because you are so much more productive after you've exercised. Your brain's clearer and you've refreshed it. So I'm finding that we're having less of the ergonomic work type injuries and more of the overuse athlete type injuries, and we've just got to try and get a balance to have neither.
And there'll be some people listening to this who are very active. I know we certainly both have kind of networks of people that that either they work on an elite spectrum, or they are very enthusiastic recreational athletes, endurance or otherwise. And you're seeing people running ultra marathons around their back gardens, and I mean, I think not having anything to plan or train for, people are potentially at risk of overdoing it and maybe overtraining. And how do you dial that back, and how would you and how would you interact with someone who's maybe facing those issues?
Yeah, it's interesting you say that, because I think everyone is susceptible to boredom, doing something due to boredom, and whether that's over exercising or overeating, they're the two most common. So you've seen this real big divide in this downtime, where people are either overeating because they're bored at home, and then therefore they're getting less physically healthy, and then they're overtraining for the same reasons. What I say to my patients is that when an elite athlete has an injury and we have them out for a period of time, they have very strict guidelines and criteria to returning back to their full activity. So if you're out for 4 weeks because of an injury, then we tend to take 8 weeks to graduate back to where you came from. So as a rule, you double how long it takes, and then you don't increase by any more than 10% each week. So what that means is, if you were someone who did 3 kilometre runs 3 times a week, then that's, I should have made the maths easier. If you did 2.5 kilometre runs 4 times a week, then that's 10 Ks a week. So then the next week, you can only increase by 10%. So you can only do 11 Ks that next week. Where you normally do 10, you do 11, and so on. And then you can go to 12.1. And it obviously doesn't have to be that specific, but that's a good guideline for people to understand, that you can't go from doing 3 lots of 3K runs a week to doing 10 lots of 5K runs. That's just way too big a jump. And so that's a rule of thumb, and you start from where you're at. So if you've not done anything before, then you aim for the 30 minutes a day, 5 days a week of moderate intensity, because that's for health, and then you build from there. And on those healthy guidelines, you do actually get more benefits if you do vigorous activity. So if you do the same amount of time but vigorously, it's double the benefit. Or if you halve the time but vigorously, it's the same. So for people who are time poor, it's just 75 minutes a week of vigorous activity. That's not very much. 15 minutes a day. Like, you really have that time. Everyone has that time.
And they also talk about the strength and resistance kind of component that recently added to that. So 2 maybe sessions, for people now, we've got everybody's got access to online Zoom strength workouts. So, if somebody maybe didn't have any hand weights or didn't have a big space or a lot of time, what kind of things could they do for their strength component?
Yeah, I mean, it's so easy to get a simple strength workout in, and you really don't need any equipment. I mean, I'm guilty of having a wonderful gym set up in my garage, and I train there every morning. But you can do things like, everyone's got chairs in their house. You can do squats to the chair. You can step up and down off the chair. You can pick the chair up and lift it above your head up and down. I mean, lots of people have children. They're pretty heavy weights, so you can pick your children up and down. It's a great babysitting form of the activity as well. I know my daughter loves to come and sit on my back as I'm doing push-ups, so I'm doing weighted push-ups. I mean, there are so many things, and generally what I will do is, people who want help, I just have a consultation with them and say, okay, what are your goals? Because it's really important to have a goal. If you don't have a goal, then you're going to wander off. Like, you're not going to stick to it. So you need to have a goal. And then I say to people, okay, what's your setup like? What have you got? Because everyone usually has tins of something in the cupboard, whether it's baked beans, diced tomatoes, anything like that. And that's usually like a 500 gram to 1 kilo weight. So you can do a lot with that. I've never had a consultation with somebody where I've struggled to find an appropriate resistance type exercise. And it's just, simple things like squats and lunges, lifting above head, bicep curl type activity. And obviously, if you've got an injury, it's different. You've got to be careful about not to do certain things. But generally, we're talking about the population who aren't injured. They just don't know what to do. There's so much you can do.
Very motivated to exercise. I mean, you and I, I just read Kelly McGonigal's Joy of Movement, and I mean, everything that she says and her experience of just from a young age, when she moved her body, she felt good. Do you think that's genetically we're predetermined to get all the benefits of exercise? Because there's certainly people I know who say, well, look, I just don't like exercise.
Yeah.
Knowing that that's good for you, how do you move forward with that?
Yeah, it's a good question. I think there's two answers to that. Part of it is that you haven't done enough to like it. So with anything new, there's that learning curve, and there's that part of it where it's actually worse for a couple of weeks before it's better, and that's anything in life. I remember having a really bad injury. I had a lot of injuries over my career, but at one stage I had lower leg injuries, and they thought it was to do with stress fractures. So I had to have 6 weeks off completely. All I could do was swim, and it was in the middle of winter, and I really don't like swimming that much. And then it got extended to another 4. So I had 10 weeks off. And this is, an active 17, 18-year-old who was very used to doing multiple sports a day. When I got to start back, I really struggled because I thought, how am I going to fit all this in? Like, how? Because I didn't have the energy, I didn't have the motivation, because I'd stopped doing it. It was very hard to start back. So I think a lot of people get there's a fancy medical term of like the wheel of change, and you've got to get the contemplation and all that. And I think people get part way around; they just don't get far enough around the wheel for it to keep rolling. So that's one part of it, and that's where you can, getting direction and someone to keep you accountable and help. It really does make a difference there. And then what you said about feeling the benefits. The main thing about exercise for me is that it's the endorphins. And again, like you'll hear this term. It literally is like me taking my little pill every morning when I exercise. And if I don't take it, I know how I'm going to feel by the afternoon. And like I joke about it and say it's like my drug, but it actually is, because endorphins are. I mean, all drugs are chemicals, and the way our brain and our body works is just via chemical messages. And there are some people who don't feel that endorphin rush. It's very rare, but I remember talking to an elite footballer once, and he was a very good athlete, like naturally gifted athlete, but he said, I just hate training. Like I absolutely hate it. It is my job, and I only do it because I'm good at the sport and I'm required to. But the second that I retire, I will not be doing any of this. And it was unbelievable to me that someone could end up being elite and not actually get that feeling out of training, because it must be awful if you're doing something. I could never work a job that I didn't love. But that's so there are rare people, and I guess those people just have to do it for the health benefits, because we do a lot of things for health benefits that we don't like. But that's rare.
We're a bit guilty of getting really motivated, like it's the January effect, that we're going to do all these wonderful things. We start off just overdoing it, so we spend 5 days going to exercise or go to the gym, and then it gets to kind of third week in January and that's it. I mean, I think there's some science around starting very small and, as you said, incrementally.
Yeah, and just that's with anything in life. It's the same with diet, right? So if you're going to change something, it's got to be a sustainable change that you can change long term. So there's two parts to that. You've got to actually commit to it. So you've got to want to do it. It's got to come from within. If you're not doing it for your own reasons, you're not going to, you'll survive short term. You won't survive long term. So you've got to want to make that change, and then you've got to change things that you're going to stick to forever. So we it's very popular these days to do these 30-day challenges and do all of these different things. But what people do in those 30 days, like there's no way they can do that for their whole life. And they're not even like trying to do that. They're just going to do it for 30 days. And then the 31st day, they're just going to stop. And that's really, with exercise, you can't be like that. You have to do something that you could imagine yourself doing every day, and then you just increase it a little bit, and then you actually get to love it. And then the thought of not doing it is awful. Like people say to me, you're so good to get up every morning and exercise. And I say to them, that's like telling my husband how good he is to go and get his morning coffee from the shop every morning. Like no one gives praise to people who go out and get a coffee every morning. But I mean, I'm not a coffee drinker, so but I see that as I start my day with exercise, and it just makes this my day so much better. So
yeah, you mentioned, I just wanted to go back to the we've talked about multiple effects of exercise, potentially positive, but particularly the aspects on your mood and your sense of well-being and your mental health. And you mentioned that period of injury where you weren't able to do what you normally were doing. And we're also facing at the moment, people maybe being able to do less, and also facing, many other very challenging life factors that, are going to contribute to, I mean, I'm certainly seeing in my own family, anxiety and depression and a lot of mood shifts. There's quite a body of evidence surrounding the positive effects of exercise on our mental well-being. And I'm really interested that I was reading Brendan Stubbs. I don't know if he's a physiotherapist in the UK who has done he's an academic researcher around exercise and mental health. And they had that gold standard of research that we go for, the randomized controlled trial of young people, so young, healthy people who were split into groups randomly, and some of them just to go about their usual activities, their usual commuting, not to do any more or less. And then the others to do, be essentially at home, be quite sedentary and not do all that typical movement. Does that sound familiar to what might potentially be going on at the moment? And the people that previously hadn't really shown any signs of anxiety, of low mood, and these were all emerging at the end of this study, which I think is fascinating. And he says, these days you couldn't get ethical approval for that kind of research. But yeah, I mean, it's very insightful.
Yeah, it's there's so many things to talk from that comment. I think that mental health is such a big topic, and I think we're trying to understand it more, but it's because we can't see the illness, it's very hard for people to grasp it. So I think that there are some people who have diseases of mental health, such as depression and anxiety, that have it every day. And those sort of people, because really it's just a chemical imbalance in the brain. And if you've got it on a day-to-day basis, then you can't out-exercise that. So there are certainly a lot of elite athletes that have depression, anxiety, mood disorders, and things like that need the medication for it, need the treatment, and they're exercising a lot, obviously, and that's not just the cure. So they're those sort of people, and those sort of people will know that they fall into that category, whether they're on COVID restrictions or not, and that's a very different group of people. Then you've got the group of people who probably have underlying predisposition to some type of mental health, but on a very much lower scale. So again, like if you think about it chemically in the brain, your chemicals generally work the right way, but they're borderline. They're easily thrown out, I guess, with different situations. And I've actually experienced this myself. So when I was studying as a doctor, you have to go rural. You have to go into the country for 3-month stints. And I actually went to one 2 weeks after I got married. So it was obviously a huge. I got engaged before I started working as a doctor, and I said to my work, I'd like to have a wedding sometime soon. When can I have it? And they said, 18 months. You can't take time off until 18 months. I said, okay, I'll have it. So you can imagine the build up to this wedding, because it was like just this pivotal part of my life, I guess. And then 2 weeks later, I had to move away for 3 months to a country town. And I'm a very social person. So I live in an area where I could go for a walk and run into 15 different people that I know. So a 1 hour walk can turn into 5 hours. I don't have to arrange to have coffee with anybody, because I'll just bump into someone and I'll stop and have coffee. So to take me out of that situation and put me into a rural town, and also away from my sporting teams, there was obviously still like gyms and things I could go to, but it took away that social part of it. So it's not just the physical part of it. I was still exercising every day, but I was going for a run, and the only things I would see were cows, and that was like me and the cows. I felt like I was in one of those movies where suddenly all the people had been killed off and I was the only one that had it, because I was working shift work. So I was exercising when everyone else was at work, and then I was working when everyone else was at home. And I call it situational depression. I stopped eating, I stopped sleeping. I had by halfway through that term, I had to go to my supervisor and say, I am not coping. This is not normal. This is not right. And so even though I was doing exactly what I do, it was the other parts of the situation. And so I think that this COVID-19 restrictions, it's been a similar sort of setting for people. So even though you're not changing where you live, and in some ways you've got more time. It's just the routine's been thrown out. And so I was very well aware when this happened that I probably, I was lucky because I still had work, and I've actually been ridiculously busy over this period of time. But I'm very aware now to keep myself busy for that reason, and to keep myself structured and to have a routine. And I actually wrote a blog post on this on my website, but I think the most important thing is to have routine. And so, yes, physical activity is important, but it's the routine of doing something every day that is important as well. So you need to structure it in, and you need to structure other things in. And whether that's, if you're someone who can't work, there's lots of industries that just can't work, because the travel industry, for instance, you can't just change your job and adapt it because we're not allowed to travel. So those people will just not have work. But I reckon everybody has a list of things that they've put away for a rainy day, and the rainy day never comes because we get so busy in our lives. Well, this is the rainy day, so learn a new skill. Help other people out. There's so many things you can do, but if you don't plan ahead for that, then you end up in the funk of boredom and no activity, and it's very hard to get out of. So I say to people that you need to pre-plan these things, write it down, stick to the structure, and that helps you so much, because if you don't do that, once you're in it, it's a very hard spiral to get out of. Yeah, it's interesting, isn't it? Because people don't think it's a valid enough reason to come and see someone. So I've seen lots of people experiencing this, but I see it on social media. So I see it, in the posts that people put up, and my good, like some of my good friends, and I'll call them, I'll go to them. Obviously, they're my friends, but I feel like people, because on on the flip side, people think, well, I'm not actually that bad off. I've still got A, B, and C going for me, and so they feel like it's an invalid reason to ask for help. And I think that's also, um, it's a poor, like, it's a reflection of human nature. But we tend to struggle on through rather than putting our hand up and saying, I need help. And I learned very early that that's the best thing to do, is just to say, I need help. And whether that's going to a doctor or whether that's going to your family. Some people would prefer to go to a family. Some people would prefer to keep that from their family because they're trying to put on a brave face for their children or their partner or whatever. So unfortunately, I don't see a lot of people coming to me for that reason. But that's one of the reasons that I would, hope that people would use a sport and exercise medicine physician, is because we have that insight into all those aspects of health, and we have the tools to help you with things like that.
And I'm going to go back to something that we had discussed earlier, and you're just talking about the fact that you will discuss with people, lifestyle and exercise, and probably an all-encompassing holistic view of them as a person, and of, their habits and their work and their play. Do you think, I think you probably have a very important role to educate the rest of us in the medical profession. I mean, I certainly know that in my job now, I do take exercise histories, I take smoking histories, I take, alcohol, lifestyle, and nutrition, and I make a time to do that, because I do think, if you see somebody, for example, with who's facing surgery or an Achilles rupture, I always feel it's a great time to go in and say, well, this would be a really good time to give up smoking, because you're going to heal faster, you're going to have less risk of infection, and I'm kind of an eternal optimist at taking those moments. But how can we share this with not only our profession but many other allied health professions and people involved in looking after health, to encourage people and empower them?
Yeah, it's interesting, isn't it? Because again, there's two parts to that. The first thing that I would say is it takes a lot of time. So I schedule an hour initial appointment with people, and I use that whole hour. And people think, oh, I've just got like a sore elbow, you're not going to need an hour. It's like, well, it's probably nothing to do with your elbow, really. That's just the straw that broke the camel's back. So I'm looking into, as you said, their whole lifestyle, their exercise history, and why are you exercising? Because some people, they've got an overuse injury because their brother died 3 years ago and they're using it to heal their wounds, but they haven't actually spoken to anybody about it. And so every time they feel down, they go and exercise, and they're really just, that's not really that very healthy. And they actually might need help with dealing with grief as the actual cause of what they've ended up with their elbow pain. And if I haven't delved into that, then I'm just going to think they've got elbow pain because they did too many push-ups and they shouldn't have. So that's a big part of my job. And I actually spoke to a few GPs last week. Actually, it was a while ago now because it's before COVID. And they sort of looked at me and said, well, what do you have to offer that we can't do ourselves as a GP, in terms of why would they refer a patient to me? I said, well, time. You can't give an hour to every person that walks through your door, because it's exhausting. I might have 6 new patients in a row and I'm actually exhausted physically and mentally from it. So, yeah. And that's what GPs are for, because they've got to basically be the triage for the entire society. And the same with you in emergency medicine. You've like, it's wonderful that you do all of that, but really that's not your role either, because that person is coming in there because they've had something that they've thought was life-threatening or limb-threatening, and they're not really going to respond to you talking about the fact that, I mean, the smoking is a good one, because we all should be saying that constantly, because you need to hear it from lots of people. And the same with exercise, but it's more that they just need to hear it a lot of times to then contemplate changing. So you don't even have to, the rest of the world doesn't have to be, very active on what the answer is, just mentioning the problem. So, we see overweight people in society all the time, and we almost feel like we can't say anything about them being overweight because that would be discriminating against them. But in actual fact, that person might be really unhappy about being overweight and just not have any idea about how to change that. And maybe they don't want to bring it up, but maybe if someone brings it up and says, look, your weight is on the bigger side for your height. Have you ever thought about trying to change that? Do you know how to change it? Bringing it up in a sensitive way might be all that person needs to open up and say, oh my goodness, I would love help with this, but I'm too ashamed of my weight to be able to ask somebody for help or something like that. So I think that, the smallest, just talking about things with people constantly and then saying, there are people that actually do this. This is their specialty. Oh, absolutely. And it comes back to that whole, nature of doctors wanting to be fixers. I need to fix something and I need to do something to fix that person. And if you don't, if you're not doing that, you seem to be not doing your job. And I think, it's a really, sometimes I even doubt myself. I come away and I think I just spent 6 hours talking to 6 people. And I examined them and I did a few things, but I didn't really do anything that they couldn't have done themselves. But then I think about it, or my family will say to me, there's no way they could have done that themselves. And it's just interesting because the more that you know, the more you realize how much you don't know, but also the more that you forget that people don't know what you know. So even, I'll say to someone, oh, look, you really need to stretch your glutes. And people will be like, oh, how do I do that? And I'm thinking, oh my goodness, of course, they don't know how to stretch their glutes. I just think that everyone knows how to stretch their glutes. And so we undervalue our own knowledge because it's gained over such a long period of time.
Yeah, and I think we're very guilty of assuming knowledge in our patients too.
And how much repetition they need. I love the whole Chinese whispers thing, where I love hearing from people. They've seen another doctor. A lot of them have been to so many different people before they get to me. And then I'll say, okay, what did that doctor, what do you understand about your problem? What did this doctor tell you? And I love hearing it from their words, because then I've got the letter from the doctor and then I've got their version of it. And often it's just so different. And you think, no wonder they're not completely getting better. And I take it for granted that I can tell someone something and then they're just going to go and action it and they're going to be better. But often it needs to be over a long period of time, small changes and understanding about that. So it's more important than I probably give it value for, but I'm learning that.
Spot on. I don't want to monopolize all of your time. I really appreciate the time you've already given up. I mean, there's so much gold in this, and I hope that we can maybe revisit some other topics that I have in mind in the future. But I'd want to finish with a bit about you. I mean, you are athlete, mother, doctor. I mean, I don't really know how you've done the half of what you've done over the time. When I read when I read your bio, I was in awe. But what does good health mean to you, and how do you look after your own self-care and strike a balance?
Yeah, it's funny you say that, because I recently was given my fellowship, and then also I spoke at a conference recently. So 2 different times someone sort of read my bio out to the audience in front of me, and I thought it sounded ridiculous. Like, you do things and it's just normal to you, but when you hear it back, it's like, oh my goodness, like that is really ridiculous to have sort of.
Well, I really hope you are very proud of your achievements.
Yeah, no, I'm very proud, and it obviously doesn't come without sacrifice and a huge support network. So, essentially, I took on specialty medical training, a PhD, and having 2 children, all of us in the space of 6 years. And I still played sport through a lot of that, and then exercised my way through it, and that was a non-negotiable for me. And that's probably the only reason that I could do it. And also, I'm someone that knows what I need for my health. So I need to have each day needs to be slightly different. So I need to be doing different things on different days. So the fact that I could do a PhD part-time and then do specialty training part-time really helped, because I'd loved the days where I could sit down and just write and be absorbed in my research. And then I loved the face-to-face days in my clinic with my patients. And then I assist in theatre one day a week, and I love that. I call it my day on the tools, because that's my day that I can switch my brain off. And it's just like, if I can do something physical, and it's really all about the banter with the anaesthetist and the surgeon. And it's fun for me to go in there. Plus I get to help people as well. And so I structure my week where I do something different each day, because the repetition to me is what kills me. And then I also make sure I have to be obviously very rigid. I had a 10-year plan. I think after we got married in 2010, and I had a 10-year plan, and that included where I was slotting my children in. And obviously you can't just put children in where you want them, but they kind of came around about. I think it took me 6 months longer with one and 8 months longer with another, and actually worked out. yeah, actually worked out better in the end, in terms of the timing and just things like, travel. And I had to, because I travel for work a lot, so that's, logistically tough too on my husband, especially. He's a full-time worker, plus he looks after the kids. I've got my parents, both sets of grandparents, are wonderfully supportive and live very close, and I certainly couldn't do it without them. But also for me, I do it all because it makes me a healthier version of myself. Because I remember when I was pregnant with my son, and I'd got onto the specialty program of sport and exercise medicine, but I hadn't started yet. And I said to my colleagues at the time, I was doing a year in rehab medicine. I said, I I'm happy to keep pursuing my career, but I'm equally happy to stay at home with this child and be the most overqualified housewife in my suburb, and that would can fulfill me. I would be fine to do that. And my colleague, who was a female and a mother, laughed at me and she said, "You will be back at work well before you think you're going to be back." And I looked at her and I thought, oh, she doesn't, like, what's she talking about? Like, imagine the thought of just being at home with your kid and just, coffee dates and manicures and walking Esplanade, which I think every male thinks is what, or every female thinks is what motherhood is before you actually enter it. And I planned to take a whole year off, and I was back at work 3 days a week, 8 weeks after my son was born, because I could not handle the monotony of staying at home. He had like a terrible reflux, and he hardly slept. Like it was a terrible time. And people say, I don't know how you went to work, but I was getting, a max of 20 to 30 minutes at a stint at night for years, like all like up and down all night with him. But I went to work because it was my downtime, because it was actually more relaxing than being at home with a baby who was really unsettled. And I felt so guilty about asking for help with a baby just because I was struggling as a new mum. But it was easy to ask for help for my baby if I was going to work, because it was like, well, I was giving back to the family by earning money. I don't even know if I was earning much money, but it was like, in my mind, it was okay to get my child looked after by grandparents, or my husband to take a day off if I was working. But if I was just struggling as a mum, that was just like, that was my job. So if I wasn't doing my job, I couldn't get someone else to do my job and then do nothing. So that was, and that's a terrible way to think. I certainly, I like to help a lot of women that are in this situation for those exact reasons. Yeah, and so I found that balance of working part time, and being at home, it made me such a better mum. Like, I was so happy to walk in the door and see my kids. I remember, when my son was 18 months old, he was just up all night. Like, it would take me an hour to settle him, and he would sleep for 20 minutes, and he'd wake up again. And there was a point where I was just looking into his cot. Probably, I don't yell very often, but I I would have had a very stern voice and said, "If you don't learn to sleep, you will never have a brother or sister, because I am not going through this again. So you better sleep." Trying to reason with an 18-month-old who's screaming because the poor thing's got acid like burning the insides of him. And I just remember my husband walking into the room, putting his arms on both my shoulders and saying, "You just need to go back to bed," and just walking me into bed and picking up the baby. And I just think, like, oh my goodness, like, it's just, you can't do anything without support around you. And then also, my husband, he, from that 8 week point when I went back to work, he took a whole day with our baby. So one day a week he took off work, and that was daddy daycare. We still call it daddy daycare now. I've got a 7.5-year-old and a 2.5-year-old. And that was so important too, because him having a day on his own meant that we were parenting, we were equally parenting. And he was a much better parent than I was in terms of all the fun stuff. Like, I'm a bit like the Von Trapp family dad. I'd like to have a whistle and line my kids up before dinner and just suit my personality. But but my husband's, he'd do the bath time for me would be clean them and get them out. Bath time for my husband would be 5 hours of pantomimes and different voices for all the toys and things like that. So we're a good team, and I think that's what you need. You need to have that balance. But it's certainly, I think, giving, if you're trying to be successful and work and be a mother, you need to both parent. You can't just have like the mum role and the dad role. And you can't, mums have this innate thing that the babies, they smell us, they want us. Like, my daughter now still wants to, "Oh, I want mummy." And I think, why do you want me? Like, I'm the strictest of everybody. You never get treats from me. But I think it's an innate thing in kids, because they're with you for 9 months. They can hear your heartbeat, they can smell it, they know all of that. And so if you try and get the other parent to, and whether that's another mother, but the one that hasn't had the baby, or a father, if you get them try and do something with that baby, but you're there, then you'll always revert to, oh, here, let me do it. It's easier. Oh, you've got to not be there. So you've got to let them experience being a parent without you actually hovering over them. Because you can helicopter parent your kids, you can also helicopter parent your partner with the kids or your mother with the kids. Or so I say to people all the time, like if you're going to have time out from your child, you need to actually not be there. And they're like, your mum raised you perfectly in her eyes, in your eyes. So let her be with with her grandchild. It's going to be okay. That's really important as well for mental health, to have that break. And it's a break from work, it's a break from being a parent, like whatever it is, you just need a break.
Yeah, so on that, we've acknowledged that your work is physically and mentally exhausting. I know that you like your morning hour in the gym. What else do you do to take time out and give yourself some downtime?
Rest. I don't know what that word is. I try and rest. I'm not very good at it. If you ask my husband, he'll say it doesn't exist. So what I do is we travel. We travel away. So we and my husband works, very hard, and he takes his work home too. So we're always working, and we're never not working when we're at home. And I walk in the door and I clean the house because it's just my OCD, and I just clean, and then I do something, and then I've always got work to do, and I work until I think, oh my goodness, I have to go to bed, and then I go to bed, and then I get up and I do it again, and that's not healthy really for me long term. So we travel away.
So, could you describe your ideal self care Sunday, and if you had a pillar of health that you needed to prioritize right now in your life, what would it be?
Yeah, so I've recognized that. So I actually have to remove myself from my house. That's I would truly relax at the beach. In a summer, it's easy. A Sunday in a summer is easy. I get up, we train. I'd prefer to go to the gym, because I think if I'm training at home, like in an ideal world, I can do the exercise at home, but then my kids walk in and out. I need that exercise to be a break, and I need to turn my mind off. So I also don't want to be my own coach. So going somewhere to train with friends, because I think, as I've said before, the social aspect of training is just as important as the physical aspect. So I train with people that are like-minded, that I like to train with. We push each other hard, and it doesn't have to be the same ability. I train with my mum at my gym. She's 65. She scales the workouts, but she still pushes as hard as she can, and that's what I love about exercise, that people pushing themselves as hard as they can. Then it'd be a long breakfast, breakfast turns into brunch, turns into lunch by the time I'm eating. I love food. I love people to make food for me. If I'm at home, that's my husband. I don't do any of the cooking. If it was me, we'd probably just have, I don't know, something that I could heat up in the microwave over and over again, or eat without cooking. But I do love eating food, and it's really and healthy food. Eating healthy food makes me feel so good physically, but I love the taste of it as well. It's not it's not a chore. If I don't like the taste of something, I'm not going to eat it. But there's so many options. You just choose what you like. And then in summer, it would just be a day at the beach with the family. I think there's something really relaxing about sitting still when the water's moving around you, because the only times I'm truly resting, yeah, the only time I'm truly resting is on a boat or at the beach, because I will literally sit still. That's the only time I'll sit still. And it's interesting because I see it in my son. I know I'm homeschooling him at the moment, and he's wriggling all over the chair when he's trying to do his maths work. I think, can you just sit still? But like, I can't sit still. So of course he can't sit still. And then the afternoons, probably social catch up, either a cook up with friends, or I love live music. I love to get out. I mean, obviously it's, I'm saying that I love to travel overseas and around Australia. I love to go out to socialize with friends at cafes and restaurants, and I love to go out to live music. And I can't do any of those right now, like none of it. But I've still coped really well, because you just adapt, and I make sure I exercise at home, on Zoom with friends, and I have catch ups, and you can exercise with two people now. So I choose a different person each time to go do something with. And my kids, like they've been brought up that way, so they're used to it. But they also need to leave the house for those little spurts, or go outside in the backyard, like leave the inside of the house and that sort of thing. So I know what makes me balanced, but yeah.
And I think that's such an important point. Self-knowledge when it comes to what works best for us, where our limits are, and what we need to do to get ourselves in the best space, physically, mentally, emotionally, it should be a goal. I notice I'm a big fan of a motivational quote, and I notice that you have a few good ones on your website. Are there any other mantras, theme tunes, quotes you like to use to bolster and encourage yourself?
Yeah, it's funny. It's funny you mentioned that because they were actually testimonials and I put them up and they were little quotes from people who, patients of mine. And then I found out very quickly you're not actually allowed to advertise with testimonials as a doctor. I had no idea. So I quickly had to change the night of the launch. I had a lot of colleagues who thankfully had my back and text me straight away and said, you can't have those up. So I decided then to put, motivational quotes, and I quickly found those. But I think that one that I've always loved that sort of sums me up is a quote that says, commitment is staying loyal to what you said you were going to do long after the mood that you said you were going to do it in leaves. And that's so true to anything, because you can't, like life isn't just like roses and chocolates. It's going to be ups and downs, and you've just got to stick through the bad times and know that the good times are going to come again. And I think that's really important because so many people just ride the ups and downs with their moods. And I think you've just got to learn that it's probably going to be okay again, and you just got to stick it out. So I love that one. And as an athlete, I mean, it was always no pain, no gain. But as a doctor, that's definitely not what
I... Fantastic. And any final tips that you would give to our audience to encourage them to get active, stay active, and make physical activity part of their daily prescription?
Yeah. So I think that the two most important things is work out what you actually want to do. Don't do something because someone else is doing it, or because you should, because someone said something, because you won't stick with it. So there's going to be some form of physical activity for everybody out there. So figure out what that is and don't be swayed by whatever the trend is at the time. And then the second part to that is you need to write it down the night before what you're going to do the next day. So you have to commit to it in terms of, if you're going to be doing a workout at home, then you write out what your workout is. If you're just going to go for a walk, then you write out, okay, at this time I will go for a walk. And then you put an alarm in your phone and the alarm says walk. And if you commit to it 100% in your mind the day before, you're far more likely to do it, and then it becomes a habit. And then the other part to that is, if there is a really bad day that you can't do it, it doesn't mean that you just throw the towel in for the whole rest of the month. Because I know a lot of people who do these sort of clean eating challenges, and then they have one little bit of chocolate and they go, oh, I might as well have the whole block. Well, no, that's not right, because one little bit of chocolate's not that bad. So everything in moderation. So, if you do need to listen to your body. I would love to train every day, but sometimes physically I know I need a day off. So I take a day off physically, and I know that mentally I'm going to have to do something else to compensate for having a day off exercise. So I might go for a walk with my kids or something like that. But it's the things that you've got to do is commit to it and make yourself accountable to that commitment by putting it in writing and telling your people that you live with, this is what I'm going to do, so that they have your back. And then adapting to it, and then not falling off the horse, throwing everything in by a little slip up. Just start the next day fresh again. Leave the past behind and move into the future, because that's all we can do, really.
Oh, I think that's just a perfect note to end on. Thank you. Thank you so much for your time. I think everybody's going to find this really valuable. There was so many pearls in there. I'm going to give a link to your website. Where else can we find you?
Yeah, so it's Shire Sports Medicine, all one word. That's so the website is www.shiresportsmedicine.com.au, and then the Facebook page and Instagram are also just Shire Sports Medicine. And I'm actually, because of this, there's some good things to come from COVID, and one of them is the telehealth sort of aspect of infrastructure. So I actually do telehealth consultations as well. So at the moment, they're only set up for pregnancy. I do a lot around counselling pregnant women and postpartum women to get back to exercise or to continue for exercise.
And is that anywhere in Australia?
Absolutely. But I can also do these other types of, I can do any appointment telehealth. So if people are living in rural, remote and want to sort of discuss these things we've talked about, I can easily set up a telehealth appointment, because you don't have to be face-to-face. It can be even overseas. Yeah, it can be anywhere. Obviously overseas, I've got to work out the time difference, but anywhere in Australia, it's very easy to do. So which is so good, because people in rural and remote communities should have the same access to things as people in the city. So it's a wonderful thing that we've got. So yeah, get in touch.
Perfect, Brandi. Thank you so much for your time. You have just been listening to the rather fabulous Dr. Brandi Cole. I'm sure you'll agree with me that Brandi's dedication and passion for her subject really shows. I'll put a link to Brandi's website and where you can find her in the show notes. There's some really useful links and resources there too. So Brandi's mantra was that staying loyal to what you said you were going to do after the mood has left you. I'll certainly take this through my week. But I think it's important to acknowledge that each day when we show up, we often do so with a different mind, a different body, and a different set of circumstances. And we need to really meet ourselves where we are and not let perfect be the enemy of good enough, a bit like me on this podcast journey when it comes to making positive changes. I hope you enjoyed this episode and we'll tune in for the next installment. In the meantime, stay safe, stay well, and keep going. You're doing great. The MBA New South Wales ACT does wonderful work for those of our colleagues who are, at this very minute, experiencing a hard time. One way you can show you care about doctors' welfare is to go to their website, www.mbansw.org.au, and donate today. Knowing that their colleagues' care is a big part of these doctors' recovery, so please be part of the solution. All donations are tax deductible. If you can, please consider a monthly donation, as even small amounts collectively will allow them to plan their growth to support the increased demand.